just out of quarantine now. And I'm happy to announce that my natural immunity is holding because I was around a bunch of other people. They all got COVID and I didn't. So there's that.
Which just goes to show you he had COVID directly, last March?
Almost 2 years ago.
Wow, that's amazing to think about how much time has gone by and you've still got immunity.
I did get vaccinated, but with Pfizer, so we know it doesn't work anymore.
Oh, I don't have my time.
Yeah, I'm getting them now.
Welcome back, all of you listeners, to our live weekly medical show here on News Talk 760 WJR. I'm AnnMarie Cronin, and we are back again tonight to talk to you about prevention and why you have to start looking at healthcare from a different perspective. Dr. Brian Kolender, MD, is joining us from Birmingham, Michigan, to give us some hard talk about dealing with our health and making sure we get the necessary testing. We're inviting you to call in if you have a question at 800-859-0957. Again, that's 800-859-0957. Dr. Kolender, we're still in the midst of COVID, getting worse, surges going on all over the place. What's the news of the day? What should listeners know?
Michigan's hopping with COVID, that's for sure. I mean, my phone's blowing up 2-3 people a day getting COVID. And so we're treating everybody early, getting them on their supplements, getting them on their hydroxychloroquine and their Z-Pack, and keeping everybody out of the emergency room. That's our plan. And then, of course, there's Omicron to talk about, although I wish we had a lot to talk about. It's brand new, and I don't think anybody knows much yet.
Well, it hasn't started to spread yet, right? I mean, Fauci said it was where in California, and it's sort of not really spread yet.
It's pretty. I don't know that it matters. You know, it's gonna spread. The question is, what is it? You know, does it respond to the vaccines that we have? Does it respond to do we need new vaccines? How sick does it make people? How, are you able to develop natural immunity to it? I mean, we don't know anything about this at all. So, I mean, this is out there, but we just know nothing. So there's just not much to comment about except get down to the basics, which is get yourself healthy, build your own immune system. This is back what we were talking about 2 years ago when COVID started. You got to know where your health is, make yourself healthier, boost your immune system so that whenever you get exposed to something, your body's in the best shape to fight it.
I think the most important message of the day is that you better find a doctor and make sure that whoever your doctor is, ask your doctor, what happens if I get COVID? You don't want to go into the hospital because they're not going to do anything for you there. Are you going to take care of me, and how are you going to take care of me? It's not about masks anymore or vaccines anymore. And while we've got Siobhan on the line tuning in from New York, Siobhan, one of your bandmates came down with COVID. Who treated him? What happened with that? Do you know what happened?
Well, it wasn't one of our bandmates. It was one of the members of the
one of
band.
the opening band, right? Exactly.
Yeah, so we're on a tour. We have our band that's kind of its own bubble, and then we've got 2 other bands that are opening for us. But yeah, we found out that one of the members of the opening band came down with it. Everyone was required to be vaccinated, so everyone had the vaccine, but he obviously had some sort of breakthrough case. And, they had to drop off the tour basically for 2 weeks to make sure. So far, no one else got it, which is great. We all had to kind of quarantine and be safe. But I'm not sure what sort of treatment he got or how sick he got. It seems that he's okay. But, again, he was vaccinated. So it seemed to be in pretty good health aside from that. So I think he probably fared pretty well.
I mean, we're getting a lot of people with, vaccine breakthroughs. Granted, they're doing okay. They seem to recover pretty easily. I'm still treating people aggressively, but they're coming through pretty easily. I've only had 1 or 2 people who've been vaccinated that had, that were a little tougher to treat. I mean, I've got someone right now who's taking a little longer, but he'll be fine.
Yeah, the most important thing is you're confident that he's going to be fine. And that's the past 2 years that you've been treating patients with COVID. They've all stayed alive. None of them have gone into the hospital. Wouldn't it be great, that utopia, if we could say that for everybody in America, that, hey, if you get it, all you need is a shepherd to shepherd you through it. And that's the big problem right now. The big problem is maybe 90 or more % of the people don't have a shepherd. So what are they supposed to do, for the listeners that are tuning in?
Well, they've got to find somebody willing to treat you. That's the bottom line. We've said it all along. If you've got to have a plan for COVID, because right now the standard of care, and we go into a lot of detail on the Sunday show about this coming up in a few days, which is, the standard of care for prevention is poor, and the standard of care for treating COVID is worse. In both cases, it's go home and wait to die. And if you feel sick enough, go to the hospital, whether it's chest pain or whether you can't breathe because it's COVID. And so just poor plan. There's no goal for anybody other than decide on your own whether you should be in the hospital or not.
But when you go to the hospital, you're not going to actually be treated with the medications that you're giving your patients. So you're not going to be treated. So you have a very poor chance of coming out of it.
Well, you can't be treated because anything that's in the hospital isn't indicated. So the things I use are not literally allowed to be prescribed in the hospital. So even the things that are approved for emergency use by the FDA, such as monoclonal antibody therapy, is not approved for inpatient treatment. And the sad part is...
Wait, I'm going to back you up
Yeah.
there. Is that true? You go to
It
the
is
hospital
true.
and you can't get monoclonal antibody treatment if you're admitted?
Correct. If you're able to get it through the emergency room, great. But the problem is there are not enough infusion centers prescribing or using monoclonal antibodies. So this is a major, tool for keeping people alive and out of the hospital that is not widely available and should be. And why this is the case, I can only speculate. And you don't want to hear the speculation. They want you vaccinated, and that means the more horror stories about being hospitalized they can tell drives the vaccination story. So if that's the story you want to listen to...
Well, let's come back and talk about that on the other side of the break. Again, you're listening to our weekly live medical radio show, where we keep you up to date on all medical solutions, from dealing with COVID to avoiding catastrophic disease. We're here with Dr. Brian Kolender, MD, talking about prevention. And if you have a specific question and you'd like to talk to the doctor directly about what you need to do to prevent or reverse disease, please call us at 800-859-0957. Again, that's 800-859-0957. You're listening to News Talk 760 WJR. So we're back on Facebook.
Yeah, so we're back on Facebook, and it looks like we're back at 7:19. So we have a few minutes.
We might have been on Facebook for 20 seconds.
Who knows? The timer seems to be
Right.
always off.
Yeah,
The music's always playing ahead of time, but
We should...
Melanie says hello from Florida, so we have a listener from
yeah,
Florida.
Melanie came back. No, Melanie was originally from Korea, and then she moved back to Florida. So she's done her stint in Korea now. I don't know how many years she was there, but she was one of the expatriates from this country. And Kayla told me she moved back to...
I thought I recognized the name.
Yeah, right.
We just lost a lot of street cred.
Oh, right, exactly.
It's okay. We still have international listeners that are tuning in. So.
Oh, that's for sure.
Well, we should talk about the Omicron a little bit, although, it's...
Well, I thought Fauci said it was contained and that it hadn't spread yet.
What?
That's been the story about everything until it spreads. So,
no, nothing that guy says means anything. Sorry. I mean, really. So we can...
I'm letting you away with that because you're not on the air. Okay, fine.
Yeah, but so don't bring him up. How about this? Don't bring him up.
But that's this is the point that I'm trying to make to you. You're a doctor. He's the face of the average person that puts on the TV. He's like, there's God, then there's Fauci. That's who I'm listening to, because I can't get in to see my doctor. I can't get in to see a doctor for love nor money. So therefore, I got to wait and see what Dr. Fauci has to say, and that's it. And until such time as Dr. Fauci is taken off the air, he's the man.
Which is why we're all screwed.
Well,
all of us, because that's driving a narrative that's going to kill everybody.
He can say all he wants while we're off the air.
Right.
It doesn't matter to me.
Well, that's
Whatever.
not what I was going to talk about. I mean,
Yeah.
but
Well, it's
it's
okay. We're back in a minute, but
all
go
right.
on.
No, it's just more prevention. You got to get back down to doing what you can to prevent things, because you are in a brand new unknown, and it doesn't matter, what anyone says. No one knows anything about this. Even Fauci, he has no idea what this is, what's going to happen, what does it mean. The knowledge doesn't exist.
Yeah, but it doesn't matter. What matters is you need to have a doctor who's going to take care of you when you
Well,
get sick.
he
I
doesn't
mean, this
treat
is all like,
anybody.
I mean, he doesn't, but he needs to be telling people, like you need to be telling people, make sure that that was we're coming back on the air in a minute. Very loud. If you're just now joining us, I'd like to let you know that we're welcoming you to our special weekly medical radio show on News Talk 760 WJR. We're back again with Dr. Brian Kolender, MD, internal medicine physician and specialist in prevention in Birmingham, Michigan. After 20 years in practice and watching patients die prematurely and unnecessarily, he's here tonight to give us some hard advice on what we need to do to avoid heart attack and stroke altogether. We're inviting listeners to call in with your questions at 800-859-0957. Again, that's 800-859-0957. And before we come back to Dr. Kolender, I would like to tell listeners to tune in to the Sunday show. Dr. Kolender is on every Sunday at 3 p.m. And he's certainly going to be talking more in depth about what you need to know about COVID and how to take care of yourself moving forward. Dr. Kolender, coming back to this discussion that we're having, which is, and obviously your practice is heavily and completely about preventing heart attack, preventing stroke. But all people are worried about right now is, what am I going to do if I get COVID? Where do I go and how do I get cured?
Well, I'm going to say the benefit of being in my practice is that I have a small practice. So people reach me, and I've encouraged everyone to call me the moment they are sick. I tell them to get tested. And if they're positive, we take action right away. I don't tell my patients to sit home and wait until they can't breathe and go to the emergency room. We act immediately. And also, because I have a preventative health practice, we know where everyone's health is. We know who's who's sicker, who's at higher risk, who isn't. Everyone's on some kind of individualized plan to make sure that they're healthy, which is synonymous with boosting their immune system. And then I'm like to think I'm a little more forward thinking, and I want to prescribe and act and provide my patients the tools to stay away from COVID. So, I'm doing some of the frontline medical tools and providing them for patients. And with Omicron here, it just opens up this conversation all over again.
Dr. Kolender, Siobhan, we got callers?
Yeah, we do have some callers. If you'd like to jump to them first.
Yeah.
Okay, so let's start with Joe in Westland. Joe, what's your question?
Hi. I was treated for 7 days last Christmas, got out on New Year's Day with remdesivir and steroids. They did a terrific job. Ever since, I've been doing fine. I'm masking, I'm being careful. I only go out to the grocery, I go to work, and I'm not around a lot of people, crowds. What's the latest on my antibodies? How strong am I, having been treated, especially in the hospital, not just having it and rehabbing at home like my wife and daughters did, because they had it mild.
Well, I don't know that. Well, thanks for calling, and I'm happy to hear you did well, first of all. You're on your anniversary coming up, so your COVID anniversary. So I don't know that it matters whether you were in the hospital or not. A mild case generates immunity. I don't say the same as how your immunity is defined is based on your body's ability to mount an immune response, not on how severe your immunity was, how severe your case was. So what we do know is that natural immunity, which you and your family acquired, is longer lasting, more enduring, and stronger than vaccination immunity. Unfortunately, we don't have a way to test it. So there's not a blood test. that identifies the T cells and B cells in our bone marrow that have that immunity. So I would like to think that you're immune still from that experience, but again, because you got so sick, you're someone who probably should get a booster. And also, if you're a regular listener, we've been promoting the Moderna booster for Delta. It just seems to last longer. If you got that sick to be in the hospital, I'd get a booster. But again, your whole family should have some long-term immunity.
Siobhan, we have other callers?
Okay, yeah. So up next we have Bob in Shelby Township. Bob, what's your question?
I had a vascular surgery last Monday, and they tried to go through my right leg to remove plaquing. They couldn't get through, so now they say I've got to have an extensive surgery, but only if a cardiologist would okay it. I have AFib, I got a heart murmur, and a hemoglobin of 8.1. So what do I do if the cardiologist says no?
Well, Bob, do you have pain in your legs when you walk?
Yes.
So you have claudication.
Yes.
But you're not having chest pain. You don't have angina, when you walk.
No.
Okay, so
all in both legs.
well, there's a study that was published about this time last year that says that medical management is as good as surgery for angina. And having claudication, which is blockage in your legs, is the same as having angina. So I would like to think that there's hope that you could, and we do this. This is what I do: is optimize a medical management approach to reduce your inflammation of your arteries and heal things. And that's something I would seriously consider. And maybe it'll save you from having a major surgery. But also keep in mind you're at major risk for a cardiac event when you have that kind of leg injury. That type of vascular problem in your legs.
So, Dr. Kolender, a quick question here. When you talk about medical management, I wonder if the listeners understand what medical management is, because basically what you're saying to this patient is, you've got this situation and it's certainly serious, but it doesn't necessarily have to wind up with surgery. Am I understanding correctly?
Correct. So, and this isn't just me. So I would say, again, this is a study that was published about December or January of 2020 or 1920 that said that I would call it basic medical management, exercise, nutrition, stop smoking, is as good as a revascularization procedure, which is a stent or bypass in someone with stable angina. So if we're providing an optimal medical management program, then I like to think that it's better than having surgery. So is there a chance to bring you off the ledge, Bob, without having this major surgery? Absolutely. But you'd have to come in and take the leap with us.
No, that's really fantastic. I always, when I hear you say medical management, I always think the listeners don't really know what that means. And it's basically you shepherding them through a personalized, examination of where they stand. And then you're telling them what they have to do, not like just go home and, eat well and exercise and do this and do that. You're actually walking them through what they have to do. That's what medical management is.
Well, there's a lot of dots to connect that you'd be
Right.
shocked are not being connected. Like it all makes sense. And why no one's doing these simple dot connecting, it would blow your mind. And so I'm the one who puts it all together. And when you put it all together, you're healing your artery. So it's it's not magic. It's not, it's the things that we do are simple. The blood tests are simple. It's just that no one's able to put it together because our healthcare system doesn't allow it. Our healthcare system requires you to have each of these individual things handled separately. Your vascular problem, your immunology problem, your blood pressure, your cholesterol, your cardiac, your endocrine, they're all your sleep, they're all your oral health. All of it's got to be tied together in the same place, and then we can heal your arteries. But it'd be for someone like Bob, it'd be a ton of work, but it can be done. How about do that and just be healthier the rest of your life instead of have some devastating surgery then he may not survive. He needs cardiac clearance. Well, a
Yeah.
lot of people need cardiac clearance. That's not a big deal. But he really needs cardiac clearance. He's going to need to have a heart catheterization to clear him for surgery.
Before we close, I just, close the segment, Bob. 866 Kolender, call Dr. Kolender's office. That's 866 KOLENDER if you'd like some further information on your journey. And we wish you well. Good luck with your future health care. In the meantime, we're going to have to take a quick break. Again, you're listening to a special live medical broadcast on the prevention and medical management of disease. If you have a specific question and you'd like to talk to the doctor directly about what you need to do to avoid heart attack and stroke, or have a question on any of the subjects we're discussing tonight, please give us a call at 800-859-0957. Again, that's 800-859-0957. You're listening to News Talk 760 WJR.
Boy, it's so nice not to have COVID calls, like actually what we want to talk about.
Well, I mean, that's the whole point. But I mean,
Yeah.
no, I mean, just think about it. This guy is a typical example. This guy is lost.
Well,
with a
there's
capital
millions
L.
of guys like people like
No, but I
this, men and
understand.
women.
He's
Right.
like, he doesn't know where to go. Nobody's giving him the right direction. It's like, go see your cardiologist. Can't get in to see the cardiologist. And he's walking around with something that is probably curable. He doesn't have to have surgery. Maybe it is.
Well, there's a shot, but you got to take it. And when someone comes in that's got that many problems and they're that critical, a lot has to happen fast.
Well,
We don't have the luxury of time.
the point is he has no mentor.
Right.
That's the problem with all of these people that are calling in. They're out there, they're lost. They're going to see Dr. A, Dr. B, Dr. C, specialist A, specialist B. And then they're standing back and going, oh, I guess I might probably wind up having to have surgery.
Well, he has a vascular problem. He's seeing a vascular surgeon, and let's cut it out. And
Right,
that's what surgeons
Right,
do.
exactly.
And it's, well, let's cut out this little problem, and this problem might be 1 inch.
hmm
What no one seems to recognize is the process that created that little problem is happening in his whole body. It's involving every
Who's gonna tell him
single
that, though? Is this
artery.
primary doctor, primary care doctor? Who's going to tell
Not
him that?
his, because he hasn't been told.
Well, yeah,
So
but that's the point.
no one's been told.
I mean,
it's
he's just basically a typical example.
that's the whole world. Everyone's being, everyone goes. We've said it, and we've said it on the show that my main patient, my first patient that I saw when I started doing prevention, the cardiologist told him, mission accomplished after he had his bypass. He fixed the one thing, his 1 little inch of artery that was blocked. The messaging there is so poor that, oh, you're done. Go back to your life and do whatever the hell you want. Well, then you're going to be back there or die, because you're ignoring all the other conditions that led up to this. Don't worry, you're done. Good, you're clear. It's open. Don't worry about it. Horrible messaging, all that to take a little credit. That, oh, look what I did for you. I sent you to the surgeon and now you're okay. It's terrible.
I mean,
we did have 2 more calls come through, by the way, but when we're back on the air, just so you know.
All right, let's go right to those.
Okay.
I mean, it's just pathetic when you listen to people like that.
So can we say, if someone says, I don't have a question, just a comment, just cut them off right then and there.
Right,
You
exactly.
cut them off.
I'll do.
I mean, I can't be the good guy and the bad guy.
Well, you're never the bad guy. You're never the bad guy.
I need to be sometimes.
No, you're never the bad guy. You might be like the only hope for people out there. I mean, that's why I gave him your number. It's like, okay, what is he supposed to do? He's going to go back online and call all of his doctors and say, what am I supposed to do?
They don't have a choice. It's just a mess. People are lost because
Michelle,
they're
he's on
lost
the
because
east
the
side.
system is just a darn mess.
Whatever. So when are we back? Let's see.
Any second.
33, yeah, very soon.
So we're just taking a break on Facebook. We're not really giving Facebook people their due. Their full money's worth.
Full money's worth. Welcome back to our special live medical broadcast on News Talk 760 WJR. We're fortunate to have Dr. Brian Kolender, MD, internal medicine physician and specialist in prevention, here tonight to give us some straight talk about two important topics, prevention and being proactive. Please tune in to our weekly shows Sunday afternoon at 3 p.m. and live always Thursday at 7 p.m. We're inviting you to call in with your questions and talk to the doctor directly at 800-859-0957. Again, that's 800-859-0957. And before we get back to Siobhan and her list of callers, if you don't get your call, take down this number, 866 Kolender. That's 866 KOLENDER. And that is Dr. Kolender's medical practice. If you need to reach him directly, Siobhan, who do you have?
Yeah, so up first we have Robert in Novi on the line. Robert, what's your question?
Hi, hello. I have a blood pressure question.
Go for it.
Okay.
Okay, sorry, I couldn't hear. So I'm 53. After a couple of years dealing with COVID, I'm about 28 pounds overweight, but I've been exercising my whole life. My BMI has always been high because I've worked out. But recently I've been tracking my blood pressure, and it's been running around the 140s to upper 150s over 90s to 105.
That's a little high.
Good.
Right. That is
Yeah,
a little
so
high. Ideally, you want to be 120 over 80 or even lower. So when you're running that high, the first thing we say is make sure that you identify your risk. Get screened for artery disease, get your coronary artery calcium score, get your CIMT to measure the layers of your artery wall to measure risk, and then also treat your blood pressure. And when you get your lifestyle in order, maybe you can come off blood pressure meds. But it's important to get your blood pressure down because it's a driver of injury to your arteries. Also, get a sleep study because sleep apnea is very common, and sleep apnea can cause high blood pressure.
That's
Okay,
interesting.
is there any other thing that could be causing that?
Well, sleep apnea is a pretty big one to identify. So that's the main one. Most of the time, blood pressure just is there. There's also a connection between elevated uric acid and high blood pressure. But the main thing is this is a sign that you've got some drivers of chronic illness, and get everything checked out and don't look at it as just a blood pressure problem. This is a on your way to chronic illness problem. Figure out where you are and what all your other drivers of disease are. If you look at it as just a blood pressure problem, you're missing a lot of opportunity here.
All right, Robert, thank you for calling. Siobhan, do you have another caller?
Yeah, we have another. So now we have Pat in Richmond on the line. Pat, what's your question?
Hi, thanks for taking my call. I got an eye exam recently, and the doctor's like, "Oh yeah, your vasculature in your eyes kind of a window to your health." And I was wondering, is that overstated, or does everything show in if you're vascular, your eyes healthy, does that guarantee you got pretty good health in your body, or is it, I was just wondering how accurate that statement was.
Well, great question. This is really good. So thanks for asking that, really, because so in the big picture, that is correct. Your eyes are the window to your health because they're looking at your arteries. But unfortunately, there really aren't enough. There isn't existing a imaging tool that we can measure degrees of inflammation of the retinal arteries. So again, this comes back to looking at your carotid artery. We do this carotid intima media thickness test, which is a way to measure the layers of your artery wall, measure the layers where plaque buildup occurs, and that provides data points that we can follow over time to measure your risk. Those measurements correlate directly with risk for cardiovascular events, and we use them in our office to gauge our progress and our treatment plans. So even though everything you said is 100% correct, unfortunately, not actionable. So the resolution on those exams are not great enough to tell you anything other than the big picture is, well, there's something going on, and then you better go, get your arteries evaluated.
So, Dr. Kolender, what should Pat be doing then? What's his next step?
Well, it's what we tell everybody to do. You need to know your personal profile. You need to go get screened for vascular disease, whether it's with us, you need both. You need a CIMT, you need a coronary artery calcium score, and then you need to have someone to shepherd you through the process. Because even if those are normal, some people have drivers of vascular inflammation that doesn't generate cardiac disease, but it might develop Parkinson's or dementia. So finding all of your drivers of disease is important because it may not present as artery disease.
Okay, Pat, thanks for sharing your story. Siobhan, you have other caller?
Yeah, we have another caller now. We have Jerry in Shelby Township. Jerry, what's your question?
Yes, if I walk too fast and carry something, I end up getting like there's an elephant sitting on my chest. What kind of problem do I have, or is there something going on that I should have it taken care of?
All right, well, great questions. Again, everybody's asking great questions today. So we've got great, smart listeners on WJR. I can't say enough. So was it Jerry? Jerry, what you're describing to me is unstable angina, or it could be stable angina. So you're having chest pain with activity, and that is a symptom, could be a symptom of a blocked artery. So normally I would say, I'm not so big on stress tests, but when you're having a symptom, you need to get a stress test. So this is a place where you would get that kind of test because you're having symptoms. This is no longer screening. This is getting a diagnosis. So if your stress test is normal, you still got to figure out what's causing these symptoms, but go call your doctor, get a stress test.
Okay, Siobhan, do you have another
Okay.
caller?
Yep, we did have another caller come through. We now have Rebecca and Livonia on the line. Rebecca, what's your question?
Hi, my son and his family all have COVID. Well, his daughter did, but she's over it now. The two boys don't have it yet, but he's still sick, and his wife. Is there anything we can do to speed up the healing process? And their dad is a cancer patient. How long should he stay away from anybody who's had COVID or not been vaccinated? Thank you.
Well, a lot of stuff in that. Thanks for calling. So I tell all my patients that they should be on high dose vitamin D3, at least 5,000 units a day, zinc 50 milligrams a day, quercetin with a Q, by the bottle's directions, and vitamin C. I also prescribe hydroxychloroquine for some patients early on. I do the other thing for some patients, early on, which we're not mentioning, so we stay on the air. And it's important to do all that stuff early. As far as was it your father who's had cancer? He's really got to keep his distance, wear a mask. I don't think anyone should go around him for like a month just to be safe. He should be distanced for a while just to keep him safe.
All right, Rebecca, thank you for calling. It's interesting. I'm just listening to this caller, and she's got all these people in her family that have got COVID, and I'm wondering who is shepherding them through getting well. I mean, you're, throwing out, a few tidbits and giving them help, but I mean, I feel as though these callers are just lost, because that's my point, is when you get COVID and you're diagnosed with it, you can't go to the hospital. You shouldn't go to the hospital, but they need to have a doctor who's going to be able to prescribe the right medications to get the monoclonal antibody treatment wherever they have to go. And most people don't know where to go.
I forgot about that. So that's another really important tool for people to use, except you need a doctor to prescribe it. And so you got to be able to, you need a prescription. There are some urgent cares that will do a telemedicine visit to get you it. But the problem is they're so booked that you can't even get into them. It's a real,
the big problem is one of lack of time. Once you get the positive test, you've got to jump on it immediately. I mean, right now.
That's why early testing is critical. You got to as soon as you're sick, get tested. The days of like waiting it out, seeing what happens, gutting it out, let your immune system work are over. If you get sick,
get immediate treatment. Absolutely. In the meantime, we're going to have to take a quick break. You are listening to a special live broadcast tonight where the topic is your health and how to prevent disease. When we come back, if you have a specific question on the subject we're discussing and you would like to hear from the doctor or talk to the doctor directly, please call us at 800-859-0957. Again, that number is 800-859-0957. You're listening to News Talk 760 WJR.
Well, we have a long break right now.
Why?
4 minutes.
Yes.
Okay.
Yeah, this is the long one.
Right. So, well, feel free, Facebook people, to make, what is it, a Facebook message?
Whatever. Kayla
Yeah,
just
you can comment on the stream. We
Kayla-
have Danielle watching. We have Kayla watching who said
Yeah.
hi.
Yeah.
Kayla said, great summaries, AnnMarie. So I'm getting credit for something here. Great summaries. Okay, good to know. Anyway, yeah, so that's it's amazing. I mean, it's the same story. It's just a different patient. It's, the same patient with a different name, and they're all
Right.
lost. I mean, it's where do we go next?
Well, this lady with angina is a little scary. Here's someone with chest pain and doesn't know to call the doctor and say, hey, I'm having a problem.
Can you explain what angina is for people that might not know? Because I actually personally don't know what exactly that means.
Good
Sure.
point. Yeah, it's a good point. You're good.
So angina is a symptom that your heart makes when you're not getting blood flow. So every other muscle, if you aren't getting oxygen to the muscle, it'll hurt and you can stop using it until the oxygen exchange occurs, and then you can use it again. But the heart's pumping, it doesn't matter. And if you exert yourself, it pumps more and more oxygen is demanded, and the supply is limited because you have a critical blockage. So when there's a critical blockage and the demand is greater, you start killing heart muscle because it's not getting a chance to get fresh oxygen. So that pain, the symptoms, that's angina, whether it's irregular heartbeats or shortness of breath or nausea, cold sweats, dizziness, people describe a crushing chest pain. All those things are angina. And then it should ideally go away when you rest.
So what does it mean by stable and unstable? What's the difference?
Stable is when you have a predictable pattern, so like this lady is stable because when she walks fast carrying something, she has a symptom. Unstable is it's happening quicker or it happens at rest. Like you're just sitting doing nothing and that's no exertion and you have a oxygen demand problem. That's unstable angina. Or you just can't, just less and less activity generates that symptom.
Mm-hmm.
So it's amazing to me that there's still research and proof that in a stable angina environment, medical management is still better. I won't say better, as good as surgery. So why go through a surgery that could kill you when you can just apply lifestyle tools and medications and other connected dot treatments to keep people healthy?
Because it makes money.
Right.
I mean, if you wind up going to see the right surgeon, they're just going to say, let's just go in, like you said, and cut it out or fix it or do.
And you're going to do it because you think you're going to die.
Mm-hmm.
And an arrogant surgeon's going to make you think that they're the answer. And really, how would you know any different? The surgeon's not going to tell you that there's another option. Boy, look how quick that went by.
Do we have any other callers?
Not at the moment, no.
Welcome back to the final segment of our special weekly live broadcast here on News Talk 760 WJR on the importance of being proactive and informed of the resources available to prevent and treat chronic and debilitative disease. You're listening to the expert advice of Dr. Brian Kolender, MD, internal medicine physician, and one of the very few specialists in prevention in this country. If you have a question for the doctor, now is your chance to call us at 800-859-0957. Again, that's 800-859-0957. And once again, I'm encouraging listeners to tune in to Dr. Kolender's Sunday afternoon show at 3 p.m. You get a lot of information following up on what we're discussing tonight. This is the only live show. And, Dr. Kolender, to wrap it up, we've had so many callers, but they all seem to be in the same space. They're lost. They don't have guidance. They don't have anyone to shepherd them. through the diseases that they have, and they're not getting the right information. Let's face it.
Well, the whole healthcare system's a mess. It's designed to do what these people are experiencing. It's designed to get them to surgery. So the gentleman with the poor circulation in his leg is in the hands of a surgeon. This lady who was having angina with walking and carrying things, she's going to have a stress test, and because she doesn't have anyone even talk to her about prevention or a medical management plan, if she's got a blockage, she'll end up having a procedure. And so, yeah, it'll make her feel better, but you're not fixing the underlying problems driving that condition in the first place. And what people don't realize is that they are systemic, that all these problems are not directed just to that one little area of your artery. It's your whole body that's suffering, and a whole body approach needs to be applied.
I mean, it's just amazing how many people are lost, and again, let's add COVID to the picture. So as the propaganda keeps going out about new variants and surges in the hospital and no more beds and no more room in the ICU, it's like now all the primary care physicians are making it, and even the specialists are making it harder to get in for an appointment. So everybody, is just basically lost.
Well, this new Omicron to me is like a do-over or a start over. Here we have a new variant that looks a lot different than the variants we're used to. And we've got questions that don't have answers. To me, this is just, all right, a whole new round of COVID, and we don't know anything. So this is an opportunity for us to say, make yourself healthy, have a preventive plan, have someone shepherd you through it. Go ahead, Siobhan.
Siobhan, you
Oh
have a
yeah,
caller?
we do have a caller now. Let's go to Tom and Troy. Tom, what's your question?
Yeah, hi. I want to know a couple of things. First of all, how do you survive if you go into the hospital with COVID? Because the typical doctor will not treat you for COVID, and they wait till it progresses. I'm going to tell you what happened to a friend of mine in a nutshell, and this is what happened to him. They wait till it progresses, and you have to go in because you're having problems breathing. You go in, and they will not they'll isolate you, and the family will request ivermectin. They'll say no. They'll request monoclonal antibodies. They'll say no. They push remdesivir, which has a 54% kill rate, and they killed them. They refused to give them the FLCC, the Frontline COVID Care Critical Alliance protocol. They laid it all out for him, and they refused it, and he died. So,
well, that's the answer to your. Well, thank you for calling. The real and what you're highlighting there is people need to have a plan. So if you want to go with the FLCC plan, great, but you have to be ready for it.
What's the FLCC plan?
There's an online group. Again, I don't have the full quote.
But what
It's
does it
like
mean?
frontline critical. I don't know exactly, but if you look up frontline COVID, you'll probably get Googled or not to this group. And it's a group of doctors online treating COVID, by telemedicine. And they're prescribing the things that you hear about, hydroxychloroquine and ivermectin and the supplements. So there's it's not a whole lot different from the cocktail that we're talking about, that I do to my patients. So the key here is you got to have a plan. You can't wait a week in. Once you end up in the hospital, yeah, it's too late. We all know that already. You're not going to get that type of treatment in the hospital. You're going to get remdesivir and whatever other, antiviral therapy that may not work. And we already know that the things that work are being delivered in an outpatient setting. So people need to listen and say, have a plan, start taking care of yourself, know your profile. And now with Omicron out there, my feeling is, and I'm going to tell this to my practice, is I think prophylactic vitamin I, and you know what I'm talking about, may not be a bad idea now that now that we just don't know what's coming up. We don't know what the future holds. We don't know about these vaccines. We're still using vaccines that were made for the Alpha variant. Guess what? That's A, and we're on O.
Right.
That's a lot of water under the bridge, and no one's making new vaccines to handle O. I don't know why an A vaccine, which doesn't really work for D, is going to work for O. So let's get something new going. Let's challenge our pharmaceutical industry to make better products for us and keep people out of the hospital. So, but it's up to listeners to find doctors who are going to prescribe these cocktails for them early and have a plan. You can't wait. Anyone calls and says, well, they won't prescribe this stuff in the hospital. Like, no kidding. Why didn't you call for help the day you were diagnosed? Why don't you get diagnosed the day you had a sore throat? That's what you need to do. You all know better than that by now.
Well, the problem is finding the doctor, though, because if you get sick and then you're trying to find the doctor that can do this for you, yeah, you need to find them before. But how do you even know? You can't go onto Google and filter where are the doctors that are going to prescribe me these things. That doesn't exist.
Well, they're listening to the show. They know what to do.
True.
So that's why we're here to educate people about what to do. Granted, we're not marketing frontline doctors because, they're not here to talk for themselves. But, that is a resource for people if you just want COVID care. But it isn't just start and end with COVID. It starts with, how do I get myself healthy? All these things that we talk about are about boosting your immune system now, not wait till later. If you're sitting at home with a sore throat, not getting your test for COVID, I don't know, and you're listening to the show, I don't know what to do for you anymore.
Yeah, I mean, it's people just need to realize they've got to wake up and understand and be ready and know who is my point person, who is my shepherd, who is the doctor that's going to take me through this. Should I be diagnosed and, get to be, if they think they're coming down with COVID, to get tested immediately, and then immediately the next day have a plan. And they're going to have to find that doctor ahead of time. They can't wait until they get COVID.
Well, the problem, AnnMarie, is if they listen to mainstream media, there's no plan. And we're reaching the WJR audience, which is an intelligent audience because they're asking great questions. The rest of the world is watching television or whatever they're listening to, has no idea what to do because this is not being talked about. It's a one or none. It's a negative sum balance. Get a vaccine, don't get a vaccine. That's all they hear. It's a waste of time on our TV. Missed opportunities everywhere.
Well, people need to certainly get in touch with the right doctor and have a plan. Well, unfortunately, we're out of time, so I'd quickly like to thank Dr. Brian Kolender, MD, specialist in prevention, for being here tonight and for being willing to share his expertise and knowledge with regards to not only the prevention of disease, but also on the importance of being proactive and engaging with a practice that provides access to the necessary testing. This show is brought to you by Kolender Medical. I'm your host, AnnMarie Cronin, and we hope you got some useful information tonight on how to be your own advocate and take charge of your health, whatever your medical journey. And thanks to my co-host, Siobhan Cronin, for helping with the show. Please continue to tune into our shows Sunday afternoon at 3, Thursday evening at 7 for the latest medical updates. And thanks for listening to News Talk 760 WJR.
Opinions heard in the preceding program are those of the host and guests and not those of Cumulus Media or WJR Radio.
For now.
In one easy call, you can have the gift that keeps on giving by
You see how
scheduling
they're
a
safe?
free